What is depression? Depression, major depressive disorder, is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. Depression causes feelings of sadness and a loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at work and at home. Depression symptoms can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, changes in appetite, weight loss or gain unrelated to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity, feeling worthless or guilty, difficulty thinking, concentrating or making decisions, thoughts of death or suicide. Depression affects an estimated 1 in 15 adults, 6.7% in any given year, and 1 in 6 people, 16.6%, will experience depression at some time in their life. Depression can occur at any time, but on average, first appears during the late teens to mid-20s. Women are more likely than men to experience depression. Depression is different from sadness or grief, bereavement. The death of a loved one, loss of a job, or the ending of a relationship are difficult experiences for a person to endure. It is normal for feelings of sadness or grief to develop in response to such situations. Those experiencing loss often might describe themselves as being depressed. But being sad is not the same as having depression. The grieving process is natural and unique to each individual and shares some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from usual activities. They are also different in important ways. In grief, painful feelings come in waves, often intermixed with positive memories of the deceased. In major depression, mood and/or interest, pleasure, are decreased for most of 2 weeks. In grief, self-esteem is usually maintained. In major depression, feelings of worthlessness and self-loathing are common. In grief, thoughts of death may surface when thinking of or fantasizing about joining the deceased loved one. In major depression, thoughts are focused on ending one's life due to feeling worthless or undeserving of living or being unable to cope with the pain of depression. Grief and depression can coexist for some people. The death of a loved one. The death of a loved one, losing a job, or being a victim of a physical assault or a major disaster can lead to depression. When grief and depression co-occur, the grief is more severe and lasts longer than grief without depression. Distinguishing between grief and depression is important and can assist people in getting the help, support, or treatment they need. Risk factors for depression. Depression can affect anyone, even a person who appears to live in relatively ideal circumstances. Several factors can play a role in depression. Biochemistry, differences in certain chemicals in the brain may contribute to symptoms of depression. Genetics, depression can run in families. For example, if one identical twin has depression, the other has a 70% chance of having the illness sometime in life. Personality, people with low self-esteem, who are easily overwhelmed by stress, or who are generally pessimistic appear to be more likely to experience depression. Environmental factors, continuous exposure to violence, neglect, abuse or poverty may make some people more vulnerable to depression. How is depression treated? Depression is among the most treatable of mental disorders. Between 80% and 90% of people with depression eventually respond well to treatment. Almost all patients gain some relief from their symptoms. Medication? Brain chemistry may contribute to an individual's depression and may factor into their treatment. For this reason, antidepressants might be prescribed to help modify one's brain chemistry. These medications are not sedatives, uppers, or tranquilizers. Antidepressants may produce some improvement within the first week or 2 of use, yet full benefits may not be seen for 2 to 3 months. Psychiatrists usually recommend that patients continue to take medication for 6 or more months after the symptoms have improved. Psychotherapy. Psychotherapy, or talk therapy, is sometimes used alone for the treatment of mild depression. For moderate to severe depression, psychotherapy is often used along with antidepressant maybe. Cognitive behavioral therapy, CBT, has been found to be effective in treating depression. CBT is a form of therapy focused on problem solving in the present. CBT helps a person to recognize distorted/negative thinking with the goal of changing thoughts and behaviors to respond to challenges in a more positive manner. Psychotherapy may involve only the individual, but it can include others. For example, family or couples therapy can help address issues within these close relationships. Electroconvulsive Therapy, ECT. ECT is a medical treatment that has been most commonly reserved for patients with severe major depression who have not responded to other treatments. It involves a brief electrical stimulation of the brain while the patient is under anesthesia. A patient typically receives ECT 2 to 3 times a week for a total of 6 to 12 treatments. It is usually a nurse or physician assistant. Self-help and coping. There are a number of things people can do to help reduce the symptoms of depression. For many people, regular exercise helps create positive feelings and improves mood. Getting enough quality sleep on a regular basis, eating a healthy diet, and avoiding alcohol, a depressant, can also help reduce symptoms of depression. Depression is a real illness and help is available, with proper diagnosis and treatment. The vast majority of people with depression will overcome it. Premenstrual Dysphoric Disorder, PMDD. PMDD was added to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, in 2013. A woman with PMDD has severe symptoms of depression, irritability, and tension about a week before menstruation begins. Physical symptoms may include breast tenderness or swelling, joint or muscle pain, a sensation of bloating, or weight gain. These symptoms begin a week to 10 days before the start of menstruation and improve or stop around the onset of menses. The symptoms lead to significant distress and problems with regular functioning or social interactions. Disruptive mood dysregulation disorder. Disruptive mood dysregulation disorder is a condition that occurs in children and youth ages 6 to 18. It involves chronic and severe irritability resulting in severe and frequent temper outbursts. The temper outbursts can be verbal or can involve behavior such as physical aggression toward people or property. These outbursts are significantly out of proportion to the situation and are not consistent with the child's developmental age. Disruptive mood dysregulation disorder can have a significant impact on the child's ability to function and a significant impact on the family. Persistent depressive disorder. A person with persistent depressive disorder, previously referred to as dysmorphic disorder, has a depressed mood for most of the day, for more days than not, for at least 2 years. In children and adolescents, the mood can be irritable or depressed and must continue for at least 1 year. In addition to depressed mood, symptoms include poor appetite or overeating, insomnia or hypersomnia, low energy or fatigue, low self-esteem, poor concentration or difficulty making decisions, feelings of hopelessness. The persistent depressive disorder often begins in childhood, adolescence, or early adulthood and affects an estimated 0.5% of adults in the United States every year. Individuals with a persistent depressive disorder often describe their mood as sad or down in the dumps. While the impact of the persistent depressive disorder on work, relationships, and daily life can vary widely, its effects can be as great as or greater than those of major depressive disorder. A major depressive episode may precede the onset of persistent depressive disorder.